You've heard it now for weeks. RSV came early this year, and boy, did it come in hot.
And it's truly like nothing we've ever seen before at Children's Hospital of Colorado.
554 hospitalizations in the Denver metro so far this season. 95% of those are kids, and available ICU beds hover in the low single digits. The Associate Chief Medical Officer at Children's Hospital Colorado says their emergency department has 30% more patients than even the busiest days of previous respiratory seasons. And they're using a triage tent outside the ED.
Put it up about 2 weeks ago, and have been using it at times to take care of lower acuity patients who we can safely move out of the emergency department when the emergency department is full, which is happening much more frequently.
Children's is also bringing in traveling nurses and extra respiratory therapists, rescheduling some non-urgent surgeries, and talking with partner hospitals about patient transfer options if they should need it.
We are preparing for weeks to months of capacity challenges in our inpatient units and emergency departments because even when, and it will, RSV will start going down at some point in the near future. Flu is right behind it.
RSV isn't new, but this season is not a normal one. So what's going on? The state health department says a lot of virus timing has been off. RSV, flu, and that we can blame the pandemic.
So really unusual timing of transmission of these non-COVID viruses that we really don't fully understand. But it's very clear that the pandemic has been disruptive to how these viruses are spread and when they're spread.
A lot of this is advice you've heard before from the doctors. Wash your hands, stay at home if you're sick. But Dr. Carney said, the doctor from Children's, there's enough illness going around right now that even parents with healthy kids should maybe reconsider big events or close, confined spaces. Again, Kim, doesn't this feel like we're talking about COVID all over again?
It does, and we're coming up on holidays and gatherings, and I guess some would say, do we bring out the masks?
That question was asked of state officials today. The answer they gave is that, once again, we've heard this before too, masking is a strategy for COVID. RSV and flu, it is one tool in the toolbox. It's a good tool in the toolbox, but they stopped short of saying anything more than that. So there were no conversations around mask orders or policy changes or anything like that.
But it's understandable. When you see someone wearing a mask, perhaps that's why.
And you've probably seen more people wearing them lately.
I have.
Yep.
All right. Thanks, Jenny.